So, hey everyone, welcome back to Residency Real Talk. And myself, Tanya, and today's episode is going to be sharp, straight up, and surgical. Quite literally, because if we are diving into the world of journal surgery, and we have today someone who is wearing scrub with pride, handles high stakes procedures, and now we have, with the same passion she operated with, Dr. Shashwati Dixit, and we are so thrilled to have you today. So, goes to you.
Hi. I'm really looking forward to this conversation. I hope it's really nice.
So let's get into your story first. So what made you choose surgery, or was there a defining moment during internship or clinical posting during MBBS? What do you think about that?
I think for me, I surgery chooses you. You don't choose surgery. So when I was in my MBBS, right from my clinical postings, I always was drawn towards all these surgeries and OTs and everything. So I was very inclined towards that. Plus, in my internship, I think my seniors were very helpful. So I learned a lot. They let me do all the sutures. They taught me a lot. So I think that was it for me.
Yeah, that's amazing. Surgery is often, seen as intense and long hours, emergency calls and high pressures. So, what do you think students, the MBBS students or residents, the PG students misunderstand the most about this branch? What do you think about that?
I think, of course, surgery is hectic. It is something that takes all your time and energy. But one thing that I'd like to tell everybody is you can always have a work life balance. Maybe not initially because these are your really hardworking years, but eventually I think you do find a balance. If you really want to, you can do things that you actually like and it won't be a hindrance there. You can manage. You just know, you need to know how to.
Yeah, but sometimes students think, that surgery can feel like a mountain, so many topics, classification, protocols, and there's hectic schedules with also there. So, from your experience, what's the most high yield or underrated topic students shouldn't miss for their exams?
See, I think every other branch is requires a lot of classifications and everything. But surgery has a lot of it. I get it. But one topic that is, I from personally, I feel that is really underrated. But every resident or every intern should know is the perioperative management. That is a wonderful topic from Bailey, but you need to know how to manage the patient. Like you need to read the fluid therapy and this and that. So yeah, that is one topic that's really important.
Yes. So nowadays, like surgery is evolving, and there's a minimal access surgeries, trauma care, surgical oncology, and we have now like AI assisted procedures and robotics and many more advancements. So, what do you think? Like, where do you see this field, surgery field, heading in the next 15 or 20 years? What excites you the most about it?
One thing that I'm really excited is I'll have a very wonderful AI assistant who will give everything on a platter to me. I'll just have to go and operate. So that's very nice. And the other thing is, I think we're also going ahead in medical oncology a lot. So I'm very excited to see how far can the procedures go, how easily can we do it, and I hope we help a lot of oncology patients. The cancer patients will be helped a lot.
Yes, yes, and the robotic surgery is now in a trend right now. Yeah, it's like every single patient wants to opt only that. So now our lot of listeners are already thinking beyond, MS and NEET is in trend. They have got NEET SSN in their sights. From your experience, how does doing surgery MS set the stage for a smooth transition into the super specialty prep? And I guess you might be preparing also, like.
Yeah, yeah. I don't think any branch these days is an end branch. With so many advancements coming up, with AI coming up, with robotics, you're saying, with minimal access, you're saying, you can't just learn MS from any branch and you can't settle. You have to keep learning. And we all know that MBBS and medical profession is such that you will have to keep learning all your life. So this is like MS doing super specialty after MS. It's must. I mean, it's not must actually. You can practice however you want, but it is an edge to it. Like if you get done with your MCH and if you do your higher education with whatever it is, so it really helps you. It helps you get a better understanding of the subject and it narrows down a little.
So let's discuss apart from this, like what do you like? What was your life about as a surgery resident? I want to know that. What was your toughest on-call night like, and any moment that tested you mentally, emotionally, physically? You felt like no. So at any point, you feel like.
Of course. I mean, I was on my on call and I was already working. I had worked the entire night. But I suddenly hear that my UG students give me a call that, ma'am, there is an emergency and we need you right now. So I rush to the OR and I see that my junior, who I had a conversation with in the morning, had met with a very pathetic road traffic accident, and him and his two friends, they were riding a bike, like three of them were on the same bike, and they had come to us and he was bleeding from everywhere. So it was very bad at that point of time. We tried saving him, but unfortunately whatever happened we could not. And I was answerable to everybody because I was the person on call, and irrespective of me being answerable to anybody, the person, the UG student was very, like, he was a student, and that was a very bad time. All my management, and I had to talk to his parents, I had to tell him what had happened, and it was very challenging and very bad. That is why, one thing that I would like to tell everybody, and I hope everybody listens to this, is please wear your helmets, please be very serious about the traffic rules, and it's very important, otherwise it's terrible.
So did that affect you like at some any point?
Of course, when you see the patients and when you see that when something goes wrong with the patient and how their families are affected, patients are affected for some time, but the family is standing outside the ICUs and everything. I think that is tremendous. The amount of pressure the parents and their relatives and your spouses have to go through is terrible. It's very bad.
And despite all that, what keeps you surgical or other surgical residents going, and what's the high that makes it all worth it?
Listen, this is a really nice question. I'll tell you. When patients come with us in such situations like these, wherein they don't know what to do and where they are, and they've met with terrible accidents, and then we treat them. So it's a long process. Or if somebody comes to us with stomach ache, or who needs to get operated urgently, and when we see him come back to the follow up after we have discharged the patient after a month or so, if there's an intense procedure that the patient has gone through, and when he comes back with that smiling face and then he remembers you for life, that this is the doctor who has treated me, that is unparalleled. That joy is something else.
Yeah, I mean, of course, you must like having a good experience after the patient is doing well after post care management and everything. So now that you have also used our Digital app, and so I just wanted to ask you, like, what helped you the most during your residency, and what are the specific some of the faculty lectures or case breakdowns or formats that you really liked in our app?
See, I'll tell you, I am, and every surgery resident for that matter is running. They're running here and there, so it's very difficult to read the textbooks as such. I mean, we can't sit with those huge textbooks, and we can't carry such huge textbooks. But with this app, you can go anywhere. You can just open that app, and you can read that topic if you have to. So we also give lectures. We are MS
Right.
students. We have to give lectures to our juniors, like UG people. And if you want a quick recap of everything that has happened, you put it on 2x and you start. You finish the lecture with such ease that it is beautiful. Also, it has AI, right?
Yes.
So we're in the middle of a viva, we are sitting in a seminar, and we have to answer something that we don't know. We quickly, like, we cheat. We have a cheat code. We just go to the we ask questions and we answer. That's brilliant. That's really nice.
Yeah. So now
I
that you
shouldn't
have
be saying this. My professors will.
no, no. So now that you have mentioned about the Dr. Wise AI chatbot, so what's your take on AI or medtech thing? The 24/7 AI chatbot that can instantly solve doubts, explain concepts, and even help you in revise in seconds and answering the questions and in the explanation or so.
All this is really nice. It is beautiful. But what my favorite was, that I'll tell you, this AI generated thing was beautiful. Everything you ask, it gives you answers in like seconds, and it's brilliant. Like it helps ongoing running residents to the core. Like we don't, our scoldings have gone down to 50% because of this. So it's brilliant. But otherwise, also, one thing that I really liked is the surgical video wherein a professor was teaching us how to do surgery. Like it was exactly on the surgical board, and he was teaching it so well. It was so crisp, and it was basically everything that I needed. Like everything was very crisp and fine. So I think it was brilliant. Everybody should try that.
So now I have I already asked this question before earlier. So what are the activities you like, apart from these all things, to be like physically, mentally, or like to be like good and prepared for the every single day.
See, I think two things that are very important is everybody should, like, I try doing physical activity for at least 25 to 30 minutes every day. Any sort of physical activity. My personal being swimming, but it's very difficult to manage everything with the residency. But if given a chance, I would love to go swimming. But either ways, any physical activity, say badminton, running, walking, jogging, whatever, for 30 minutes, and meditation for at least 10 minutes is like really important if you have to be there anywhere. I think there's no particular place and time for meditation. You can start meditating any silent spot if you find, and if you start doing it, if you do it for 10 minutes, I think it does wonders. It's very nice.
So my final question for you is like one golden piece of advice you want to give anyone for the students, medical students, or any need assess residents surgery as a specialty. What would be the one golden piece of advice for them?
I think everybody will give advice for everybody in general, but I would like to give advice to these females who want to take up surgery.
Right.
They're always compared with the OBGYNs. Like, why didn't you take up gynae? Why are you taking up surgery? It's a male dominated branch. Let me tell you, surgery, if it's a calling, if you love surgery, don't think twice, just go for it. And nobody, if they tell you you can't do things, they told me that I couldn't do surgery because it was a male dominated branch and I should rethink, it had a long study curve and everything. But see, if you want to do it, because you trust me, you won't regret it. If you want to become a surgeon, there's nothing better than that. You will love it. Every girl, every female intern or UG student who wants to take up surgery, please take up surgery. Don't succumb to pressure. You'll do great.
Maybe there's a taboo, like people are thinking, it is a male dominant.
Yeah, but I think that's not the case anymore. My seniors are like, we are they are six people in all, and there are four females and two males. My juniors, they are six females and four males. So I think that's not the case anymore. But in case you're double doubting because somebody's telling you OBGY is better than surgery, and if you want to do surgery, then go for it. Don't think twice.
Now the things are changing, so yeah, why not?
Yeah.
So thank you so much for your taking us into this world. Like it's with all its greed, grace, and greatness. And thank you for this session with you. To all our listeners, if surgery is on your radar or even if it scares you little, remember pressure builds diamonds. And also take the Dr. Shashwati tips and tips, whatever she had mentioned here. So explore more surgery specific resources and expert lectures on the Digenov app, curated to help you think, learn, and operate like a surgeon. Hope you love this episode. Share it with your batchmates and follow Dijanov. Until next time, this is Tanya Sharma, and this was Residency Real Talk only on Dijanov podcast. Thank you so much.
Bye, guys. See
Bye.
you soon.